Miss Smith is 17 years old, attending your clinic today for the first time, complaining of crooked teeth. She had seen a dentist about 3 months ago and has transferred the records to your clinic. The previous dentist had done CPITN and the score is 444424. You have taken IUPAs of all the first molars. Now address patient's concerns and explain your findings.
The pointers here would be that there is no medical history given in the question. We must find out about his or her current medications, allergies. We don't have enough data about the past dental history and what sort of treatment was done in the past. This needs to be addressed as well. Also, what is the main concern about the appearance? So it indicates ortho treatment, but we must find out what the patient's goals are. Also, what is the importance of management before we proceed for ortho treatment? So there we are looking at what is the management for the current situation and the findings that we are seeing in the x-rays. Let's go into the role play now. Hi Smith, you've been very patient while I was looking through your teeth. Well done to you. I'll sit you up now and let's talk about what we've seen.
Sure.
All right, so I've done some x-rays. I've just put that up there on our screen just for you to see as well. Now, before we discuss about what I've seen, I also just want to recap on what is the biggest issue you have with your teeth at the moment.
I don't really like how it looks. I find them very crooked.
All right, and are there any other concerns with the teeth?
No, just that.
Any other pain or any other issues?
No, I want a good smile and I find my teeth really crooked.
Absolutely, yeah, that's quite, I understand where that's coming from. So now the other question that I had for you is, do you have any medical problems, any medications, any allergies that you have?
No, I have not been on any medications.
Okay, and in the past as well, you've not had any issues, anything that you had to see a doctor for?
Yeah, probably a fever now and then. You
Okay.
can probably ask my mom or my GP for those.
Yeah, that's fine. Yeah, that's good. Now, the other thing that I wanted to know was, we do have records that was transferred to us from your previous dentist, and but I was just wondering, what sort of treatments have you had done in the past?
I went to him for braces. I told him my teeth look crooked and he started lecturing me about some other thing and I was not really comfortable there. So I found and looked you up and I thought you can help me better than him.
Oh, okay. Yeah, no, I understand. Sometimes it can be a little bit disappointing when, we want certain things. And yeah, I see. And I'm here definitely to help you to the very best abilities that I
Yes,
have.
please. I want the braces on.
Yeah, absolutely. So now before we talk about braces, I want to touch base with you on what I've seen on the x-rays and also what the previous dentist has sent us with their records. It does indicate that you have advanced gum disease, which we call as periodontitis. So what happens in this situation is the teeth are losing support from the surrounding bone and the surrounding structures. So the teeth are becoming weak. So if you look at the x-ray, you will notice that this is where your healthy level of bone is and this is where there's not enough bone. So this indicates that there is something happening there. So I just wanted to know, what sort of oral hygiene practices do you follow?
I brush my teeth in the morning and I rinse my mouth after brushing, but that's it. I clean my tongue maybe once in a while. So I'm getting braces, right?
Well, we will get to that. I promise you, we will get to that. But I just need to know, have you had any issues in the past where you felt like your teeth were moving or you had any bad smell or bad taste or any changes that you've noticed with your teeth?
Nothing that I recall of. I just noticed that I had better teeth as a child, and then now that I'm growing up, and then I find them crooked, and I want braces.
And the other thing I wanted to know was, do you smoke or drink?
No, I'm 17, I'm underage.
I know, yes, okay. Well, I'm certainly glad that you're not doing it. given your age as well. That's good. Are you stressed at the moment? What do you do? Are you going to uni? What do you study?
Oh, I'm in my grade 12, definitely stressed about what uni I'll get into, but what does that matter? How is that related to my teeth?
Yes, absolutely. That's a good question. So, all of these factors do influence our oral health and our gum health, and they all can cause weakening of the tooth structure. If our gums are not strong, our teeth can't hold in its place. So, that's the reason why I've had to ask these questions. But thank you so much for answering them with a lot of patience. Now, I've now once we have already discussed about the X-rays. Now, we now have to think about what are we going to do next. So the first and the foremost thing is to stabilize this condition. We have to make sure that we are not making this worse. We have to make sure that we are not going to lose teeth because of this condition. So I will have to refer you to a gum specialist who will give your teeth a thorough clean, and he will look into ways of stabilizing these teeth and stop it from getting worse.
And I can get braces after?
Yes, certainly. Once these teeth have been stabilized and the gum specialist is happy with the level of bone and the stability of those teeth, then yes, it's definitely an option. But we must address this before we think about braces.
Can't you do them side by side?
So with braces, what happens is we do need to put excessive forces on some of those teeth for them to move together and align well and look good. But the teeth on which we have to put forces are the very teeth which are now weak. And so they don't have much support from the bone. So if we start doing that, then those teeth will become really weak, and then we are at a risk of losing those teeth.
Okay, I understand.
Yeah, so I know this is all a bit too hard for you to take it in, and I know it can be a bit disappointing, but like I said, we must address what the issue is first before we think about braces. It is a possibility for sure in future, but I would say that addressing our gum concerns should be our priority right now.
Okay, doc, if you can tell me what to do, where to go, I think I'll be there because I really want my teeth straight.
Absolutely, I understand that, and we should definitely work towards this together. So the first steps would be that I will first we will go through all your teeth and gums, and I'll create a report, and I will write a letter to the specialist, and we'll send it to him, and we will wait for you to be seen by the specialist, and they will correspond with me as well after the treatment has started, and they'll keep me updated about the progress. And once we have reached a stage where everything looks good and it is stable, that's when we can go ahead and plan further to improve your smile. Does that sound like a plan?
Yes, that does. As long as I'm getting the braces at the end and my smile looks all pretty, I'm ready to do all this.
All right, that sounds like a plan. So let's go ahead and finish the rest of the examination. All right?
Yeah, sure.